Okie dokie. So, chapter 28 is hematologic and renal emergencies. So we'll go through both of these systems here, starting out with hematological system. So this is blood. Represents its own kind of organ system, and it does have some specific functions, right? Each of one just as important as the next. So control bleeding by clotting. Your blood has its own ability to clot, which is great in 99% of the problems. Delivery of oxygen to cells, very important. Every single cell in our body needs some form of oxygen fairly continuously. Removal of carbon dioxide from those cells. Again, our cells don't like the waste products just kind of sitting there, right? They get angry. So we got to remove that waste product. And then removal and delivery of other waste products to organs that filtrate and remove them. Okay. Main solid components of the system: red blood cells, white blood cells, platelets, and it's all suspended in a plasma. So each of those four things has kind of a different responsibility. Red blood cells kind of, actually, I think we go through this here in a second. I won't get ahead of myself. There are certainly different medications that patients commonly take that can affect each one of these things. Aspirin being an antiplatelet. We've got different medications that can either help suppress or elevate white blood cells depending on what issues your patient has. Red blood cells, certainly things like iron supplements, blood thinners, all of that can kind of affect those. All right. Blood clotting. So aggregation of platelets is the body's most rapid and initial response to bleeding. So this is something, again, we've all probably experienced at some point. If you've ever had a cat scratch or a skinned knee or some sort of abrasion, you probably started bleeding. Before you could get pressure on that bleeding, it probably stopped, right? In most instances, with those small little abrasions or lacerations, the bleeding will stop on its own. Reason being, we have platelets, and those platelets' job is to stop bleeding. And they do a very, very good job unless there's hemorrhaging or really severe bleeding that's going on, and then they really don't stand a chance. But our body does have that initial response to try and stop bleeding, and it works very well. Clotting factors are a group of proteins that are produced in the liver and released into the bloodstream. Once activated, those clotting factors start forming clots throughout clotting cascades. So there's these different processes that allow us to form clots. Our body also has the ability to break down clots as well. It kind of does the same thing. It like builds the clots and breaks them down at the same time. And through that, we get nice, good, healthy clots that happen. Coagulopathy, so an abnormal clotting of blood. This can occur when the body forms clots too readily or patients clot too slowly. So there's different diseases or disease processes like hemophilia, liver disease, von Willebrand's disease that all kind of affect clotting and make it so the patients aren't able to clot as well. And then there's things like medications that patients can take to inhibit clotting or to aid in clotting if they've got one of these disease processes. With blood thinners, that's kind of a standard question that we ask for all of our patients, especially if there's any sort of trauma involved in the patient, whether it's a simple, fall off the couch or a more complex, say, car accident. We always want to ask, are you on blood thinners? Patients who are on blood thinners have a chemical reaction going on in their body that's no longer allowing their blood to clot in a way that's normal. True blood thinners change the viscosity of the blood. So I'll give just some general examples here. So if you guys, honey is thicker than blood would be, but if you took a jar of honey and dumped it out, it's thick, right? It's going to take a while to actually kind of flow out of the jar, right? If we put honey on blood thinners, that changes the viscosity, and now when we dump it out, it's going to be a lot thinner, more like a maple syrup type consistency, right? Or maybe like a water type consistency. That all those thicknesses all refer to the viscosity within the fluids. That's all blood thinners really do, is change the viscosity of the blood. Now, there's different medications out there that are classified as blood thinners that also do other things, but that's the general idea behind blood thinners, is to change the viscosity. Okay. So care for patients that have coagulopathies or clotting issues. Standard precautions, of course, get treatment as early as possible. So if they're bleeding, we got to stop that bleeding as early as possible. Get a history from the patient. Know that, hey, they're on either blood thinning medication or blood clotting medication. Hemophilia patients, it depends on the type of hemophilia and kind of what's going on, but oftentimes they're on chronic medications, and then they'll have like an emergency medication. If they do come across a traumatic situation where they start bleeding, they'll have like another medication they can take right away that'll supplement and kind of help slow the bleeding as well. So figure out kind of what we're dealing with, and then go with whatever medication we can give the patient or they can administer themselves. Supplemental oxygen, keep them comfortable, and take them to the hospital. Sensing a theme with all of these treatments, right? Comfort measures, take them to the hospital. Anemia. So this is a lack of normal amounts of red blood cells in circulation. So acute anemia oftentimes is caused by things like sudden blood loss. Chronic anemia, this can be recurrent heavy menstrual cycles, slow gestational or gastrointestinal bleeding, and then diseases that affect bone marrow or structures of the hemoglobin as well. So there's a lot of different things that can cause anemia. Other things like poor diet, genetic factors that kind of play into it. Pregnancy plays into it as well. There's a lot going on there. So a lot of things that can kind of cause it. As long as the cause isn't sudden blood loss, there's not a whole lot we can do about it. If the cause is sudden blood loss, the only thing we really can do is